The World Hepatitis Day is being observed on the directive of World Health Organization. The GEM hospitals have been always endeavoring to inform and educate the public on health issues, and in continuation of that tradition, this World Hepatitis Day also, we have arranged programs to interact with the public in the form of free liver checkups, free vaccination for hepatitis, free online consultation and interactive sessions to educate public for a week, starting from yesterday till August 2nd. This pandemic has disrupted a lot of things in healthcare sector also. The patients with diseases and lot of issues are not able to approach hospitals very freely because they fear that corona will be there in all the hospitals. At GEM hospitals, we have consciously kept corona patients away from our hospitals. We are not admitting them because we have been doing liver transplants, kidney transplants, we have been operating on major cancer surgeries, and those patients are coming back to us for chemotherapy, and the transplant patients, liver and kidney transplant patients, they keep coming for reviews. So those patients are immunologically compromised. So protect their welfare, we have consciously kept the corona patients away from our hospitals. So the hospital premises are corona free. Even to facilitate a better environment, for this 1 week, GEM hospitals, they are conducting a drive-in health checkup program for public. People can drive in their vehicles, come and get the checkups done without even entering the hospital buildings. Arrangements have been made to that extent. The immunization is also being given free of cost. I am very happy to inaugurate this program today, and I request Dr.P.Senthillnathan to elaborate on the programs further.
Good evening to all. At the outset, I'd like to thank our CEO, Dr. Ashokan sir, for inaugurating this online CME program for the public as well as for the online consultation with our experts, especially in the field of liver and allied specialties. It brings me immense pressure from GEM Hospital to start online public interaction with a talk on how to understand the liver problems as well as how to what's behind the process of the disease process called the jaundice. Starting from today, we, as Ashokan sir pointed out, we'll be having a lot of interactions, lot of topics. We have chosen those topics which are really of very good potential for clarifications, potential for the to have all the doubts cleared. So I'll start with the liver, how it functions. And you all know the background of this particular program initiated by GEM Hospital. Yesterday was the World Hepatitis Day, and as a result of the World Hepatitis Day, WHO observes it for a day, but we at GEM Hospital is observing for a week with various programs, and one such program is this public interaction program. After my talk, Dr. Palnivelu will be releasing a video on how to have a safe liver. Liver is an organ which does many functions. If you look at all the organs, it will have one salient function. Say, for example, if you take heart, it has got a pumping of blood function. If you take, say, eyes, it sees, it gives a vision. Ears, it allows us to hear something. But liver is one organ which does multiple functions, not one but multiple functions. Take for example, it produces bile, it detoxifies all the toxic material which we generate. It stores glucose. It whenever we starve, it works as a storage house or glucose. It releases the glucose when there is more of energy need. So and also it produces lot of vitamins which are essential for clotting of the blood. So basically, these are some of the salient functions which I am enumerating. As a result, the medical world has not produced one tablet or one treatment which can clear the liver failure. For heart failure, we have medicine. For any other problem, say for example, diabetes, hypertension, or any other organ failure, we have medicine. But for liver, we don't have one clear-cut medicine because liver doesn't do one function. It performs very many functions. So that's why one tablet or one medicine which can fit and then which can solve all the problems of the liver you don't have till now. So that's why the concept of preventive medicine for liver is very, very, very important. And you'll be surprised, apart from the skin, liver is the largest solid organ of the body. But are we giving importance, so much importance to the liver? No, it is not. So I will enumerate the common diseases, the common perception about the liver, and the ways of protecting the liver. Liver, as I told you, produces bile. And the moment I see bile and jaundice, you will be having lot of thought processes in your mind. No other symptom will have a varied belief myth as the word jaundice does. Because right from the word go, jaundice will give various interpretation to various people. Likewise, bile. In Tamil, we say pittam or manjal kamalai. So that those two words give varied meaning to various people. So I'm here to clarify what is jaundice, what is bile, what's its significance to the liver disease. For that, you need to understand how a bile is produced. The bile, which is essential for our digestion, is produced in the liver with some raw materials, including the hemoglobin. The blood's RBCs are broken down, hemoglobin is released, that is essential for the production of bile. Through various intricate process, liver produces bile in the liver cells. We call it as hepatocytes. Liver is producing those bile, which has lot of other components like bile salts, bile pigments, cholesterol. All those things are impregnated into that liquid called bile, which is produced in the liver, and through small biliary radicals, it's like a channels. Through those channels, the bile that is produced in the liver is taken into a common pipe called the bile duct, and then it gets transported to the intestine or transferred to the intestine. The bile not only does the digestion in the intestine, but it also detoxify some of the detoxified products are excreted through bile. So imagine such a nice, very important function of the liver, bile production. So bile is essential for absorbing the fat. At the same time, through bile, liver is excreting some toxic product. So when this process can be affected widely at 2 points. One, liver cannot produce bile or liver cannot synthesize bile. The second problem is liver production is normal, bile production is normal, but it cannot come and join the intestine. There you have the jaundice. Either way, if you have problem, you have jaundice. That you have to understand. Jaundice is not a disease by itself. Please understand. It is a symptom. It is a symptom or a way by which we could understand that something is wrong with the liver. Say, for example, fever is a symptom, pain is a symptom, headache is a symptom. Likewise, jaundice is a symptom of an underlying disease, which is mostly in the liver. But for us, jaundice or manjal kamal means it's only to go to the native treatment, get it cured. It is not like that. By simple test, we could able to differentiate where the problem is. Say a simple blood test, liver function test, will tell you whether the bile production is at fault or bile bile juice joining the intestine is at fault, whether it is production or transportation. Imagine an industry. You have a raw material put into an industry, which then makes the goods, and then goods have to be delivered to the customer. So there two problems can happen. One is the transportation of the goods to the customer. That is one area, and then the production itself is at fault. Likewise, in the liver, if the production of bile is itself at fault, there is a separate set of disease. The transportation is at fault, then you'll have different set of diseases. You need to understand the difference. The former one, where the production is itself is at fault, means the liver is at fault. There is a liver failure. If the transportation is at fault, it can get blocked because of cancer, because of stone, because of stricture, because of narrowing, or because of pancreatic problems. So we need to differentiate these two things. But in general, people believe that jaundice is one disease and we can get cured with native medicine. Even though I am a practicing allopathic doctor, I have to confess that certain production defects, production fault, especially because of viral hepatitis, viral A, D, and E. Because of that, if you have a jaundice, in allopathic medicine, we don't have a good solution. Thereby, you go for native treatment like the Kilanali, all those things. But if the production is normal and if there is a transportation problem, then it is majority of the time it has to be either surgical or it has to be through gastroenterology solutions. If it is a stone blocking the bile duct, then we have to do an endoscopy to remove the stone, and then the bile flows, jaundice disappears. If there is a cancer at the transfer at the bile duct or at the pancreas, it can block the bile. Then you have to do the surgery to remove the block. If it is a narrowing, the bile duct itself is shrunken, then also you'll have jaundice. Then you have to find out what's the cause and then do it. So basically, I'm here to say there are two types of jaundice. One is the production fault. The other one is the transportation fault. Both have different treatment plans. Please don't confuse with one thinking that jaundice is one disease and you can get cured with some wonder drug. No, it is not. And finding which type of jaundice, fortunately, it's very simple. You do a simple blood test, it will show which is at fault. And by probing with some basic test like scan, you can definitely find where the obstruction is or where the fault is. So that is one thing. Jaundice, again I repeat, is only a symptom complex. We need to find out where exactly the problem is and then treat accordingly. So that we need to understand and then plan accordingly. That's one thing. Second thing is the diseases associated with the liver. Liver has extremely large capacity for us to supply all the vital and essential things for us to survive, whether it is vitamin storage, production, or glucose storage and glucose release, or bile production. It has got God has given enormous quantity, to the extent If you remove in a normal liver, in a normal healthy adult, you can remove up to 70% of the liver without, at least 65% of the liver without any problem. With the one third of liver, we can able to regenerate, and then you come back to normal in about 2 months time. So meaning we have got enormous reserves in the liver, unlike other organ. Pancreas doesn't have that reserve, or some other organ doesn't have that reserve, but liver has a good reserve. But in spite of the fact that we have good reserves, still with our constant bombardment with all sorts of bad habits, we make the liver to scry. Like alcohol, consumption of alcohol for months together, for or years together, will deplete the reserves. Viral hepatitis B and C, which spreads through blood, again will deplete the liver reserves, resulting in liver failure. Third important thing, obesity and fatty liver, which we see day in and out now because of food habits, because of lack of exercise. Obesity is on the rise. That called NASH, non-alcoholic steatohepatitis, where because of fat deposits, the reserves are lost. There you land up in liver failure. So these three things contribute to about 90% of the liver failure. And mind you, it has got huge reserves. More than 80% of the liver reserve have to be depleted in order for the liver to show up in some form of other, like the liver failure. So we have pushed the liver to the corner so that it can no longer take all these insults and all assault, so it shows up. And there we have the time, we have the opportunity to attack in the middle, stop all these bad things we are doing, so that we can prevent injury to the liver at some point. Its liver problems are not acute, especially chronic liver cirrhosis or the liver failure. It happens over a period of time, and if you try to arrest at some time when we diagnose it, it can be salvaged. So that's why we prevent viral hepatitis, prevent alcoholic fatty liver, prevent, alcoholic disease or fatty liver or obesity. These are essential. That brings us to the preventive aspect. So 80% of the liver diseases can be prevented by the all the by ensuring that you don't have alcohol, you don't develop obesity or overweight, or you have safe practices, don't have viral hepatitis, especially B and C. We have vaccine for B and good treatment for C. So in 2020, I can confidently say two notorious viruses. Now we can see viruses means you'll be afraid of coronavirus. Yes, that's one side. And the viruses that is affecting the liver, two major viruses, B and C. Fortunately, in 2020, we have got a good vaccination for hepatitis B, but somewhat less desirable treatment for B. On the other side, we don't have a good vaccination for C, but good treatment for C. So both C and B and C, if we can have, we can be corrected, treated and then kept under control. Likewise, fatty liver, it's a long process. You don't get obesity overnight, you don't get fatty liver and cirrhosis overnight. So at some point of time, if you're overweight, if you're morbidly obese, it's a time to act now. So act now, reduce the weight, either by measures like exercise or diet control, or in some rare situations we can also offer bariatric surgery if you're morbidly obese. So do whatever, but reduce the weight, remove the fat from the liver, so that liver becomes normal. The third thing is alcohol. I told liver has a detoxifying function. Yes, it does. It detoxifies all the toxins which we take. And one of the toxins that we take regularly is alcohol. And it cannot withstand, or it has a limited detoxifying capacity. And if you bombard liver with alcohol, it also buckles under pressure, so that it starts, in spite of having reserves, it starts to show up in the form of liver failure and cirrhosis. So this is over. There are other diseases which can also affect liver, but majority of these are the three which I mentioned. And these three contribute to the liver failure, and liver failure is a fertile soil for cancers. So the cancers do occur there also. Jaundice can result in jaundice. So the basic problem is liver failure. As a result, we get into problems. Unfortunately, as I told you, there is no one wonder drug. It, at any stage of liver failure, it can be arrested, but it cannot be brought back. A scar tissue is a scar tissue. Likewise, liver failure is a liver failure. You cannot reverse majority of the time liver which has failed in very, very many ways. So prevention is always the better. Best thing is to avoid all sorts of toxins to the liver, like which I mentioned. Identify these early, because liver gives some time for us to act and then correct ourselves. But in case if you leave it to the end, we don't have much of a treatment other than liver transplantation, which itself is a big topic. And with regards to the jaundice, yes, jaundice again, people have a lot of beliefs and faiths. Please be sure, I'm just repeating for the interest of you. Jaundice is a symptom, not a disease. We have to find out underlying disease. Liver is the culprit in lot of places, but whereas you also should understand liver is not the culprit where the transportation is the culprit, where the different set of treatment, different set of investigations will help in avoiding uh, going to a wrong treatment. Lot of people with the jaundice, I'm sure you will be having one such example. The moment you see yellow discoloration or of the eyes or of the skin, you go to a native treatment without consultation, thinking that jaundice is one disease and it can be cured. Please don't do it. At the same time, I'm not discouraging you to go to other form of treatment also. What I'm stressing is, please let us be very clear. Let us find out what causes jaundice, and if you are convinced that particular treatment, whatever the treatment which is there is oriented towards that particular problem. If it's a liver failure, you target liver failure. If it is hepatitis induced jaundice, you target the hepatitis. If it is because of block or transportation problem, you target all our treatment towards that. Blindly, by seeing just a jaundice, don't go to a treatment without evaluating. Sometimes it can be a cancer. We see lot of patients with jaundice, or I can say more than 50% of the patients who come to us with a jaundice, because of the cancer, they would have gone to a native treatment, delayed the treatment for a couple of months and then come back, because the jaundice wouldn't have subsided. So because of that, I'm stressing that we should need to know what causes jaundice and then treat it. And that's the way, and it's not as simple to find out. So on this World Hepatitis Day, my one appeal is to find out what type of jaundice you are in, and then try to figure out what's the treatment. I think that solves a lot of problem, delay in the treatment, especially with regards to the liver failure and cancer. So I think with this, I end my talk on the liver disease overall. That because the days to come, different experts will be dealing with different diseases like hydatid cyst, liver tumors. So overall, please, my take is, let's save liver. We have to protect liver for a healthy life. And then jaundice is one thing, don't be afraid. Classify it according to the cause and then treat wisely rather than delaying it. With this, I end my public talk on jaundice and the liver disease. Over to Dr. Velu. I think he is ready with the release of the video. We at GEM Hospital has made a video, awareness video. Dr. Velu, chairman of GEM Hospitals Group, will be releasing the video after a small talk.
Friends, today we celebrate hepatitis. World celebrates hepatitis in the sense it is one of the biggest problem, and we are not known. Everybody thinks heart is the very important for living, lung is very important for breathing, and brain is not very important for it to work. This is what everybody thinks. but slowly and seriously, liver fails, and that is where people ignore many of the times. And a small percentage of people suddenly develops liver failure, die. This is very important. Three important things in society you have to know. The liver failure may be acute or slow process, but most of them are preventable. Either because of lifestyle, we take more junk food and put on fat, and liver also become fat in the body as way, and slowly the fatty liver goes into cirrhosis and finally fails. The other way is habit, lifestyle. Today, and that alcohol habits has become a very common among the public, and without telling them, then slowly the liver goes into failure, develops cirrhosis, finally land up, but by the time that liver cannot come back. So this is second step. Third important things, we also have to look at virus infection, very common in our country, virus A, B, C, and so on. But particularly B and C is damages the liver so much, and cirrhosis, and finally end stage liver failure. And cirrhosis of the liver leads to many of them develop cancer in the liver and die. So this is one organ which is whatever you eat has to go to the bloodstream through liver only. Liver is not proper, then none of the organ can work, because proper digestion and making it and making it to energy the body is the liver. So very important. If you want a guarantee for your liver, first protect the liver, and protection is in our hand. So that today very important is knowledge. If you know the liver, why it fails, the reason if you know, then and every one of us will be very careful enough to take a precautionary measure to protect the liver. And today, more the effect of disease, not knowing the importance, that is much more worse than the disease per se itself. And that's why very important is to know about the liver, how it works, how much it is important, what are the problems will come, and so on. Today, you can see in India so many thousands of people waiting for liver transplantation at the end stage. But no liver is available. Cadaver, you don't get it very often. And one people, because of fear, our relatives don't ready to donate. And I'm now slowly the awareness increasing, but that is not important. It is our individual duties, and childhood onwards and till death, every one of us should protect their own liver. You have a good quality of life. That is very important. And GEM Hospital and is a center of excellence for gastrointestinal diseases and hepatopancreatic liver, pancreas, biliary system. So this is exclusive dedicated center, observes the World Hepatitis Day at Chennai. And during this time, and they have a very innovative way of educative programs daily for a week, and also conducting screening programs. And it is a very quick checkup one can undergo to know their liver, how it is today. Everyone should aim to do and to know the liver. That is very important if they want to have a good quality of life. So that way, I think I congratulate the GEM team that they making an awareness program and also screening programs. And so this is very important today in public has to come to know about it. I am very happy about to release the awareness hepatitis promotion video, and it is very, very important to create a public. I think this is giving happiness, and congratulations for the team of GEM doctors and all the well-wishers who contributed to part of this GEM and to serve the public. I thank every one of the VIPs contributed, given encouraging words of this Hepatitis Day. And now I release the promotion hepatitis video.
Lifestyle and do everything you can to protect your liver.
நோயில்லா கல்லீரல் குறைவற்ற செல்வம்.
Care for liver is care for life.
நோயற்ற கல்லீரல் குறைவற்ற செல்வம்.
மதுவை மறந்து கல்லீரல் காத்தால் உடம்பை வளர்த்து உயிர் வாழலாமே.
கல்லீரல் நலனின்றி அமையாது நல வாழ்வு.
கல்லீரலை பேணி பாதுகாப்போம், நம்முடைய உடல்நலத்தை நல்ல முறையிலே பேணிக் கொள்வோம். போற்றியோம் நம சிவாய்.
கல்லீரல் கொழுப்பு வாழ்வின் இழப்பு. உடற்பயிற்சி தினமும் கல்லீரல் மகிழும்.
Say no to alcohol to protect your liver.
Yes to vaccine to escape hepatitis B.
Say no to obesity to protect your liver.
Say no to needle sharing to escape hepatitis.
You have to eat healthy, have a healthy lifestyle, and protect your liver.
Cirrhosis liver corrodes life.
மதுப்பழக்கத்தை விட்டு ஹெப்படைட்டிஸ் போன்ற நோய்களை தவிர்க்கவும். உடல் ஆரோக்கியம் மிகவும் முக்கியம்.
You should eat healthy and have a healthy lifestyle to protect your liver.
Fatty liver shortens life. Avoid wine. Liver will be fine.
ஆயுள் நீடிக்க நோயில்லா கல்லீரல் தேவை. மது கொழுப்பு தவிர்க்க, வைரஸ் தடுப்பு மருந்து எடுக்க.
கல்லீரல் கொழுப்பு வாழ்வின் இழப்பு. மதுவோடு வாழ்வு கல்லீரலுக்கு தாழ்வு.
Say yes to hepatitis regeneration.
Friends, say no to alcohol to protect your liver. Exercise daily for a healthy liver.
It's crucial for us to vaccinate against hepatitis B.
Keep your liver healthy by living healthy. Say no to drugs and alcohol and exercise daily.
மதுவோடு வாழ்வு கல்லீரலுக்கு தாழ்வு. இதை புரிந்து கொண்டால் என்றென்றும் உயரும்.
I think this video has given a very much importance and enlightening the incidents and VIP participation. I hope everyone else will take a pledge today that our liver is important for our life, and every one of us should take everyday look at our own lifestyle, our own habits, and keep away from the virus infection so that we'll have a good life and need not depend on other something else. Very nice. Wish all the best. Healthy liver, healthy life.